Good morning. Can everyone hear me today? Okay, thank you. Good morning, good afternoon, wherever you may be in this beautiful country of Australia. And I'd like to welcome you all to our very first episode in our collaboration Women's Health and Wellbeing series called Healthy Women. And I am your co-host, Professor Sandra Creamer. I'm a one-year Kalkadoon, a lawyer and CEO of the Australian Women's Health Alliance, who are in partnership in doing this today. I'm here with my co-host, Associate Professor Heena Lansbury, and she is an ally from the School of Public Health at the University of Queensland. Thank you, Heena, for partnering with us to do this excellent webinar. I'd like to start by acknowledging the country that I'm on. I live on Durumba country and I am from North Queensland. I pay my respects to my elders, past and present, and those who are emerging. And we recognise that many generous so much for us today. We know that they've been our teachers and our carers and our guide for all women around the world. Thank you. We are happy to see all the registrations that we've had today for our event. Our motivation for this series is to bring the human face to the story of our health. We hope to translate key research to put the power of decision makings into the hands of women and carers and carers of women. We will do this in a yarning style so that each webinar episode has a relaxed and inclusive approach. Each episode will reach out through our network to bring you high quality health research that is tailored for listeners to clearly understand their options and for you to make informed decisions about your health, your family's health, mother's health, whoever you may be caring for, and those people in your care. We particularly want to communicate to all women with priority populations such as migrant women, as well Aboriginal Torres Strait Island women, and from different levels of education and from different paid and unpaid roles, visible women to the centre of any accessible conversation. So that brings us today to focus on our excellent guest. We will be focusing today on ageing, nutrition, and women's health. So often women are in the role of carers communities, yet they do not always have significant information or access to determine what is best for those in their care due to competing influences and confusing information that is not always in their language or not always culturally appropriate. In response, Heena and I want to bring you three experts to create a conversation that centres women, respect their lived experience and values their knowledge to ensure excellent nutrition throughout the lifespan. And that takes all of us towards our twilight years in the best health and dignity and comfort. Our guests today are Professor Devi Mohan, Dr. Mikaela Wheeler and Dr. Heena Akbar, all from the University of Queensland Public Health. For each, I'm asking them a few questions about their work and the key messages that they can give to you, to women. After we've heard from each of them, we will answer questions and you can post on the Q&A tab on your screen. Heena will manage this section and then provide a closing summary of what we've heard. So today I'm going to start with our first guest speaker, Associate Professor Devi Mohan. Welcome to our Healthy Women webinar, Devi. And Devi is going to speak to her experience of research in dementia for women. And this includes women also from Asia and Indian cultures for her training as a medical doctor. To provide our audience with some background beyond Devi's bio, I'd like to share that Devi was born in South India. English is her second language of four. Devi completed her training as a medical doctor in India and specialises in community medicine. This is where she commenced her dementia research. She is interested to know about the experience of both women with dementia as well as with carers, most of all who are all we know as women who are doing the care job. Devi has moved to Malaysia to teach some medical education and teaching. She expanded her dementia research there to cover Malaysia, Chinese, and Indian ethical groups with a focus of community-based issues in semi-rural areas. Devi then took up the role as Associate Professor in Public Education at the University of Queensland in 2021. So, Devi, I'd like to go to you for the first question. Devi, do you have a personal connection to women with dementia that may have opened your mind and interest in this research? Could you tell us about that? Thank you.
Hey, thanks, Sandra, for that wonderful introduction. And before I start, I would also like to acknowledge the traditional owners of the land on which we meet today. Yes, to answer your question, Sandra, my grandmother was a person living with dementia, a great-grandmother. Even though at that time we didn't know it was dementia, it was just that she had issues with memory, had some behavioral problems, and it was a family issue more than just a disease or a condition. And as women, I've also seen how her daughter and daughter-in-law used to care patiently for her going through those changes. But when I started, so this was partly the reason that I took up the research, but also moving forward, when I started my field work, I've seen many women and also men living in the community with dementia and facing that as a social problem. So yeah, that created my interest in dementia research.
This is very interesting. So can you describe how women are central to dementia care and management?
Yeah, that's very true. Women are often central to care and management. So I would think this from two perspectives. One is as a carer of a person with dementia, and also women as people living with dementia. So as carers, often they are the primary carers of people with dementia. So they provide day-to-day care for, say, example, toileting, feeding, dressing. And moreover, they also provide strong emotional support to their loved ones with dementia. But one of the things that we observe is that even though they are the primary carers, decision making do not fully depend on them. It's mostly with men in the family in most of the societies that I've worked with. So that is a contrast in terms of care provision. As people living with dementia, one of the major challenges that women face would be their loss of sense of identity and purpose in the household. As and when behavioral issues start coming in, the problem is they cannot manage household as they used to previously, and often they lose that central role in the family. So yeah, so women face some challenges, but also important to notice that they're very resilient in these situations.
Yeah. Thank you. And I'd like to ask about who are the carers for people with dementia and families, including the many different cultural backgrounds that you have researched in.
Yeah, very good question. In most of the Asian communities that I have worked with, care is provided most often at home, even in advanced stages of dementia. And mostly it follows, the care context mostly follows gender norms, family situation, and cultural expectations. And women, mostly wife, daughter-in-laws, assume caregiver roles in these communities because institutional care is not most of the time culturally acceptable, nor is it accessible to most communities, especially in rural areas.
Yeah, thank you. So we know sometimes in some areas, especially in the countries that you've researched, that government support is quite low for dementia care at home. If possible, how can people who don't have that government support at home, how do they go about doing that?
It's mostly in those situations, community support or social support that is necessary due to various reasons that people choose to provide care at home because of cultural expectations or due to financial situation or lack of access. If they choose to provide care at home, there should be a strong social support and community support. And one of the biggest barriers to that is the stigma against dementia. So I would think increasing awareness, providing social support in the context that they provide care are the most important things in improving support for carers of people with dementia.
Yeah, thank you. And before we go to our next guest, Could you tell me what the key messages are that you'd like to give our audience to keep in mind?
The key message is that dementia is not a part of normal aging. To understand that and to understand the fact that dementia is preventable to a great extent, we can delay its onset, and also it is manageable and can be detected early. So understanding that and seeking care at the right time is the most important thing.
Yeah. And I think also that we need to build social support for women. Do you think?
Yeah, definitely. In whichever context they choose to provide care and in whatever capacity they want to provide care for their loved ones. Yes.
And do you think there's enough of dementia awareness around at the moment?
It varies depending upon the geographical context, background knowledge, and the social context, but it is not enough yet.
Yeah. And just one last thing. We need to ensure that, especially with financial reasons, to care for dementia people with at home with family members. So looking at appropriate, well-resourced, community-based resources. Do you think there's enough of that around in our communities and here in Australia?
Not as much as I know, but I think there are social support system and provision of support for home-based care, but it is not adequate and not most of the many times may not be culturally appropriate for the needs of the communities, especially the diverse communities that we are dealing with.
Yeah. And just a quick question, what about men who are caring for their wives or their partners or who are at home? How do you think, especially that is supported as well, and caring for their mothers or grandmothers, especially caring for women? How is that approach for our men who are doing that?
Yeah, I have seen some in some situations where men, especially when they have to care for their mother and do not have the rest of the family supporting them, it is a real struggle, especially when it comes to supporting their activities of daily living, like bathing or feeding. And in the communities that I've worked with, what they would rely on is paid support, informally trained carers. So that becomes again a financial struggle and a challenge to support those activities. So, or even though women are the primary care providers in most of the situation, there are men also who take up those provision, and it also affects their opportunity to earn for a living, and those kind of economic struggles kick in. So yes, so that is also a challenge, even though not as big as women in a role of primary carer.
Yeah, thank you very much, Devi. We'll now move to our next guest speaker, who is Mikaela Wheeler. Thank you very much. Our middle speaker is going to be talking about motivation dietitian and early career research. Mikaela is, and from her work as a dietitian in aged care homes in the community, Mikaela sees firsthand that nutrition and exercise are not only focused for health, and that social connection plays a really important role as well, and the value and respect that Mikaela places on older adults through her care, through her research. So, Mikaela, thank you very much for coming on. Can you share with us about your moment of realization about the importance of social connection, and especially for those our older adults? How important is that?
Thank you very much, Sandra. And before I begin, I'd also like to acknowledge the traditional owners on the lands I'm meeting, the lands of the Yagara and Turrbal people. Um, how I first saw this with my own eyes was when I was studying to be a dietitian. I was working within a community organisation, and I had the opportunity to go and visit older people within their homes. And more importantly, I was able to spend time listening to the stories of older people in our community, and they spoke about their experiences and the challenges that they faced in remaining socially connected to their friends, their family, and their broader community, and how that made them feel. But on the other side of that, I also saw the amazing ways in which older people were staying connected to their community, the joy that those connections brought them, and the impact that it had on their broader circles. And so those experiences, those conversations, which I was so privileged to be a part of, really shaped my understanding around the importance of social connection and health and how they are related together.
Yes, thank you. So one of the other things that I'd like to ask you is something that you focused on in your research is the changing nutrition needed for older adults. What are some of the changes that occur and how does that impact our health?
So there are a range of changes that occur as we age in our bodies, and they have impacts on the types of foods that we consume and how we also um, engage with food. We do see changes occurring in our senses as we age. So that is our hearing, our taste, our smell, and our sight. When we eat, we use all of these senses. And so any changes in those is going to impact our consumption of food. So, for example, food may taste different to what it used to as our taste buds change. When we're cooking, the smell and the sounds of food that preps our body ready to eat a meal. And so if we don't have that stimulus from those senses, it can actually impact the appeal of eating, and we're more likely to not eat enough to actually meet our requirements. Um, we can also see challenges with eating enough food to meet the nutritional needs. Older people can sometimes feel fuller earlier on in the meal, and they're not able to eat as much food as they may have once done. And this occurs for a range of reasons, one of being the hormonal changes that occur as we age. But it can be a real cause of concern for carers, particularly of older people, when they're seeing their family member not eating as much as they used to. And it can be really distressing. So it's important that in this case, we're working with older people and their carers to identify strategies for them to eat enough food, so smaller, more nutritious meals across the day, so that people are still able to meet their requirements and feel supported in doing so. But those changes also extend more broadly across the body when we're looking at things like dental health and teeth. If there is pain or use of dentures or ill-fitting dentures, that again can also impact the types of foods that people consume. They may steer away from foods that are tough or chewy, and that can often be foods that are meat in particular. And that's a concern because of the protein intake that we want to be optimizing. Protein is really important to be able to maintain muscle mass and for daily function. And as we age, where unfortunately our body isn't quite as good at building and repairing and using the protein that we consume. So it's really important that we are having protein at a number of time points throughout the day. We're optimizing that intake. So that's a few things that can impact nutrition, but really what underlies all of that is if we're not consuming enough food to meet our requirements, people are at an increased risk of malnutrition or an undernutrition and potentially losing weight or losing muscle mass. And that's has such a significant impact on people because it increases the risk of falls. It impacts frailty. It can increase the risk of delirium and also impacts quality of life. So nutrition is incredibly important. Obviously, as a dietitian, I am probably a little bit biased in saying that, but nutrition is incredibly important across the whole spectrum of the life stage, particularly for older adults.
Yeah, thank you. Also, I'd just like to ask you, can you tell us about the risk of eating alone and loneliness on your health? Because we know there are a lot of people out there who do live by themselves and who are not always eating the right food that they should. So can you just tell us about those risks? Thanks.
Yeah, of course. So social isolation in itself poses a number of risks to health. So for people who are socially isolated, there is an increased risk of illnesses such as heart disease and stroke, anxiety, depression, and an increased risk of dementia. That's for a number of reasons. One related to the increase in eating or in behaviors which are, I guess, not supportive of health. So a poor diet, lack of physical activity, consuming alcohol and smoking, but also because social isolation puts a lot of stress on the body. And that stress actually diverts our body away from maintenance and repair. And that's where we can see illness occurring. And when we're looking at eating, the idea of shopping for one person, cooking for one person, and eating alone can be really, really challenging. And for many of us, that's not how we've eaten our meals across our life. So transitioning to that can be really challenging from an emotional perspective. And it can also impact the types of foods that we consume. I know if I reflect on my own eating pattern, I'm less likely to cook a big nutritious meal when it's just myself. And we see that happening in practice. We can see people consuming what is affectionately termed the tea and toast diet. So at the end of the day, not really feeling like cooking a meal just for one person and having a cup of tea and a slice of toast. And there's nothing wrong with that every once in a while. But where it runs into an issue is if it's happening multiple times, and then we see a potential risk of actually being able to meet the nutritional requirements.
Yes, thank you. And so I'd like you to tell us with a key message, what are those key messages that you'd like to leave our audience with?
So the first is the importance of nutrition. I think there is need more discussion, particularly around people who are living in the community, some of the challenges that they face, that their carers and families are facing, and how do we actually provide support to those people so that they can make changes and optimize their nutrition and their overall health. I think we need a lot more discussion and support in that area. The second message is around social isolation and the stigma that is often associated with that topic. So, in some of my work, we have found there's a general reluctance to talk about social isolation, sorry, and admitting to being lonely. Particularly with women, we saw an interesting discussion in that identifying that they were lonely some of the time, but then always reflecting there are other people that are much lonelier than I, and I don't want to take up services, and my family are doing their best, and really I guess that reluctance to be seen as a burden on their families and their communities. So we really need to be having open and transparent discussions around social isolation and loneliness to lift some of that stigma, because we're all going to feel lonely at some point in our lives. It's a biological signal of needing social and human connection. So it's about lifting that stigma and having these really open discussions.
Yeah, thank you. I think that's really important message that, if you know somebody out there who's by themselves, or always reach out to them, because social connection is very important for them. And we don't want people to feel lonely. There is always someone out there, even if they can connect to any sort of social group. So thank you very much, Mikaela. We'll move on to our next guest, and welcome to our final speaker, Dr. Heena Akbar. Heena is going to speak to the intersection between diabetes and chronic conditions prevention with culturally responsive care for Maori and women from the Pacific, also for women here in Australia, which is women from the Maori and Pacific is part of your community, Heena. So thank you. Heena is a proud Fijian Pacific woman, a community leader. She holds many roles as a wife, a daughter, a mother of twins, auntie, sister, and a senior academic and community researcher with the School of Public Health. Heena focuses on addressing health inequality through social and culturally dimensional of health. She specialises in using community participation, action research, and Pacific Indigenous methodologies to inform social policy changes that translate to equitable health outcomes for the First Nations communities, including Maori and Pacific, and culturally linguistically diverse communities in Australia and internationally. So thank you, Heena. To start with, Heena, can you tell us some of the Pacific outcomes you saw at personal and community levels for women and their health and well-being?
Thank you, Sandra. I really appreciate this. I guess I'll start by saying, acknowledge also the traditional custodians, Turrbal and Yugara peoples on the country that I'm here. Nisambula, Assalamu alaikum, and warm Pacific greetings to all. And it's really a privilege to be here today in a space where, we can share, listen, and learn together. And I really acknowledge Devi sharing the whole work around carers and dementia as an important space, and Mikaela talking about social connectivity in aging context. I guess I also acknowledge, Sandra, your introduction. So today I do come as a proud Fijian Pacifica woman, a mother, an auntie, a daughter, a researcher, and a community advocate. And what I share today for me is that I carry with me the stories and the wisdoms of many women from my community, and that includes my grandmother, my mother, and elders, and also those women who's trusted their journey through the Pacifica Wellness Program. So I just wanted to start with giving a bit of context of the research we have done in relation to diabetes self-care in our community. And diabetes is very prevalent and really real in our community. And when I say that, it not just affects us as individuals, but it in fact affects a whole family and a whole community. And I resonate that with my own Bumbu or Nani, which is a grandmother who passed on at the age of 52 from complications from diabetes. And, she lived with it for 13 years without knowing. She did not know. She was never diagnosed despite having to go and see a GP, despite going to hospitals. And this is not an uncommon event or an uncommon incident that we know many of our loved ones have actually faced this. So women in our community is at least 3 to 4 times more likely to develop this condition, and at a very younger age. And they're also at a high risk of, deaths, early premature deaths or disability when we compare them with the Australian women in Australian women. And we see that amongst women from Indigenous or from culturally, linguistically diverse communities. So our work was really where we co-designed and developed a Pacifica Wellness program with our women that included elders. And when I talk about elders, I'm talking about older and middle-aged women, and also young women with lived diabetes experience. And they are our cultural mentors. They ensure that the program is culturally inclusive, responsive to the community context. And we piloted this program with 50 of our women and their families of diverse cultural backgrounds, age groups, delivering education with health professionals who were not only from our community, but who also worked in the mainstream sectors such as health, education, and justice. So for us, this collective work is actually taken us more than a decade of making. And in that, we have included 4 community-led health forums in Queensland, in Australia, where we've used this space not only for research, but also for health check screening, providing education, collecting diabetes health data in the community that we don't have. And for us, in terms of the profound impact that it has at personal and community level, as Sandra, you're asking, it's not just what it has impacted me as an individual, but for women and girls and their families. Really, the first thing that I can think of at a personal level is about reclaiming self-care as a cultural practice. Self-care isn't selfish. It's a form of cultural preservation. Our women draw on traditional practices, having open talanoa, or what we call yarning, a dialogue, praying together, dancing, communal cooking as ways to care for their bodies, their minds, and their spirits. Framing self-care through these cultural values, or what we call VA, which is a relational and a cultural space where we can share our stories. Through spirituality and reciprocity, it becomes a shared responsibility, not just an individual burden. So we're seeing shifts in these narratives of self-care in the community where our women know that this is a collective responsibility. And for example, we're seeing that our young women feel confident putting their health first, prioritizing that because they know they're supported by their elders. In terms of at a community level, what we have done is we've created cultural spaces for intergenerational talanoa, or dialogues where our young women and girls share difficult or taboo conversations with their elders, and vice versa, just to talk about girls and women's health. And, this builds powerful intergenerational connections. The the essence of the diabetes wellness program for us was that our elders mentored our younger women and our young girls. And some of these women now we see has become champions and leaders in their own communities. They're delivering health education where intergenerational knowledge sharing, as well as the collective care, is now creating a cultural responsibility and trust that I think we know that mainstream services often lack. And what's great is that we've captured these significant moments by co-producing digital stories. And when I talk about stories, I talk about stories of our grandmothers, of our aunties, of our daughters, and of our nieces sharing this self-care journey, living with diabetes and other chronic conditions. They share their learnings about how they embrace lifestyle shifts, rooted not only just in clinical knowledge, but also in the cultural context. We're now actually using these stories and videos as a community health education tool to promote awareness around diabetes prevention and management, and also building health literacy through storytelling. The women in the community are using this as cultural resources to better understand about their body, about their health conditions. They ask informed questions at clinics with their GPs, and they support others in their families to do the same. So, for us, these these stories and this video shows that knowledge is power. Especially when you know that it's delivered in ways that are familiar and safe for us.
Yeah, thank you. I think that's really important. And I think that you've raised a very good conversation about video recording, about how that conversation can be had, because we know at times when it comes to reaching out to anybody that generally they go online and listening to something, but they can also replay all those messages if they miss out on something. It's really empowering. And as you said, information is empowering, and it's great that you do having those videos there. And I think also understanding that about the cultural care. So thank you very much. And one thing I'd like to do is letting everybody know that, I'd recommend that our viewers view your beautiful videos that you've made with your community, especially on Diet Project. And so what I'd like to now do is ask you, what is your final message that you would like to give to our audience?
Well, the two really important takeaway messages that I want people to take away. The first is that what we have seen through the program, and there's several elements of which we have seen, they're creating safe spaces for healing. They're leading intergenerational change, framing the way we know the ways of our knowing, doing, and being, and advocating cultural safe care. So what I want people to think about today is what we have seen through this program is that when you center culture, when you honor spirituality, when you embed intergenerationality and intersectionality and relational ways of knowing, being, and doing, you just don't change health outcomes. You actually strengthen identity. You grow leaders. You spark collective healing. The second is that the women in our communities aren't just passive recipients of care. They're knowledge holders, they're storytellers, they're caregivers, educators, and protectors of our young future generations. As such, I think we need to think about designing research, policies, or services in partnership with our women in a way that is respectful, humble, ethical, so that we can actually lead real transformation. So, I encourage everyone listening that keep asking, who is at the table? Whose knowledge is guiding us? And how do we honor the wisdom that already lives within our community? And these are really the important essence of when we talk about our programs, which is really important.
Yeah, thank you very much. And I think that's what we're trying to do out here with the Australian Women's Health Alliance, is bringing those different voices together as you three ladies, as well as having conversations with women who are sitting at home and having them understand the work that you're doing, but the words of what you're sharing is very important. And it's about having that conversation, bringing the invisible women to have that knowledge so that they, when they're at home working with their families or going through any of these health issues, that they can replay these messages and say, okay, this is what I learnt today and this is how I need to doing it. And I think one formed questions, when you're out there speaking to any health services or any medical board, that you are that your questions are being informed, that you're being informed by your medical doctor or your carers, so that you understand that, because we're talking about women who may be lonely at home and who go home with a different message and still unsure. This is why it's so important to start having these conversations. So what we're going to do is we're going to go to a few Q&A questions with Heena. So thank you, Heena, who is one of my co-hosts, and Heena and I have done many researches together, and I'd really like to acknowledge the work that we've done, as well as supporting and working in partnership with Australian Women's Health Alliance in doing these webinars that we're going to be continuing to do. So thank you very much, Heena. I'll hand that over to you if there's any Q&A questions. And then what I'll get back to do is after that, I'll go back to my 3 guest speakers and ask them to end with another final message. So thank you.
Yeah, fantastic. This has been so wonderful as our launch webinar. Thanks to our speakers. So, Mikaela, there's quite a few questions directed at you in the Q&A tab. And just before I say that, if everyone could head to the Q&A tab and both put up your question, but also upvote others, and we'll if we are overwhelmed, we'll go to the priority questions. But Mikaela, we've your comments about tea and toast, we're interested in some alternatives. That's what we're being asked. But also there's a question about swallowing and dry mouth syndrome, which can really create a fearful response if someone's experiencing dementia. So some real tangible questions there for you.
Yeah, thanks, Heena, and thank you for those questions. So there has already been some great suggestions, particularly for alternatives to the tea and toast diet, being egg or baked beans on toast, for example, or pre-cooked meals from family and friends. Some other things that we would consider, the appeal with the tea and toast diet is it needs to be quite easy to prepare and not take a lot of ingredients and be very simple. So we could look at things like what could we add to the toast to increase the nutrition. So we could look at potentially a toasted sandwich with double layers of ham and cheese. That's one example to try and increase the protein and nutrients of the toast itself. We could look at, can we add things to the toast? So a side of soup, whether that might be the supermarkets now sell quite good individual packets of soup or fresh soup as an aside to that toast. So again, we're boosting those nutrients. Or could we add some type of dessert component? So could we have yogurt or custard or creamed rice or anything like that that could actually just be a little bit, but just enough to boost some of that evening nutrition and not going the full step into providing a fully cooked, home cooked meal. The other question was around swallowing and dry mouth syndrome. So there are, this is really dependent on your healthcare provider and practitioner's advice. There are medications and mouthwashes which you can purchase to help with a dry mouth, because it makes it very hard to chew and swallow. So there are those options. If you're looking at foods, you want to be trying to use things like gravies and sauces to increase the liquid that's around the meal to make it softer, but then also look at consuming softer food. So if you're having a meat, if it can be a slower cooked piece of meat with that gravy or that sauce, so that it is more moist and soft for you to chew and swallow and feel safe in doing so. So those are a few suggestions that I'd have.
Fantastic. Thanks so much, Mikaela. Devi, I'll head to you and then we'll go to Heena. So we've got a question about respite care options. And I know, Devi, you spoke to a range of different cultural locations, as well as obviously in Australia, we have a range of cultural backgrounds as well. So keen to hear your thoughts on respite, but also a little bit broader, an additional question is around the issue of who is the carer, the gender of the carer, but also language diversity and whether, accessing carers with a language that's relevant to the person experiencing dementia.
Yeah, thanks, Heena, and thanks for the question. Yes, in Australia, there is formal respite care arrangements for not just people with dementia, but also a range of conditions who need care, especially for their activities of daily living. And government subsidizes care for clients who are eligible for that. But how much of that is culturally and linguistically inclusive is a question. It's a challenge. But coming to gender roles, let me talk about other contexts where respite care is not available. In Australia, even though it's formally there, in most of the societies that I've worked with in communities, respite care is not available at all for people to seek care from. But there are volunteering arrangements in the community where volunteers do support people at home when they need respite. So that's an arrangement that's existing, but not as formal as that's in Australia. But in Australia, the cultural and linguistic diversity and inclusion of these services are still limited. Probably Mikaela has worked in that field, so probably she will have something to add on as well in terms of the access in that regard. And is that the other question, Heena, regarding gender?
Yes, so I might just pop to Heena about gender and language diversity in care, especially with your deep involvement in your own Pacifica community here in Southeast Queensland, Heena.
It's a great question, and I think it's something that we need to be quite reflective of, even in a society such as Australia. We do come from a very collective culture where we come from countries and cultures where caring happens at home. And it's something for us, it's quite a challenge when we think about there's a home or a respite facility that we are not comfortable, where our elders or our older people or young people who needs that kind of facilities, that we do it by putting them in what we think is an institutional or a space. So a lot of caring of that happens at home. So I guess in terms of gender and where I see, I think as a woman in this space, and when we're looking at gender, it's true that usually our elders do take that responsibility, or our women takes that responsibility of caring, because that's something historically and traditionally has been passed on, whether it's through oratory, and it's of that mechanism of caring. Whilst the man and male do play a role, I guess their roles are more from a financial and more from a support context. And I think as we see now that as our elders are aging, a lot of that caring happens from home, and we they live with us, and we take them to their medical visits, to specialist visits, unless it's at a point where it's really it becomes impossible and they need a 24-hour care. I'm not really sure if I've answered the question, but I guess
all good.
I think we need to really think about how we frame health services and caring and that concept within a Western, which is a very individualistic manner of looking at services or caring, as versus when we come from cultures where we think very collectively.
Yeah, and I think that's part of the diversity here on the panel, is that we're all based at the University of Queensland, but you're reaching into the different cultural backgrounds, both who are living here, but also from their home countries. So back to you, Devi. At the other end of dementia is potential prevention of dementia that we've been asked about. And as both a medical doctor and a public health researcher, what can you share?
Yeah, definitely, that's a very relevant and contextual question, Heena, because there has been a lot of push now towards prevention of dementia. As we all know, there's no definite cure yet for dementia, but a very important landmark report, which was updated very recently in 2024 by Lancet, the Lancet Commission on Prevention, says that more than 4 out of 10 dementia can be prevented, or at least delayed in terms of the onset. And most of these risk factors or factors which we can target are around midlife. So whatever is healthy for heart is healthy for brain too. So managing diabetes, cholesterol, managing cholesterol, detecting early. So basically managing and monitoring all those vascular risk factors, maintaining appropriate weight, a good diet, most importantly, salt-reduced diet, which supports control of hypertension. But in early life, it is mostly education. So as educational level improves, there's more of a cognitive reserve, we say. So that also delays onset of dementia to a great extent. Smoking and alcohol use also to a great extent affects dementia. In later life, the most important risk factors that we are trying to target are sensory deficits, hearing, vision. So correcting these, detecting them early and correcting this also delays onset of dementia. But having said all this, one of the important things that Mikaela also touched on is social connection. Social isolation is a very important risk for dementia. So improving social connection and support is a very important preventive mechanism.
Yeah. Thanks, Devi. Mikaela, I'm going to switch topics now to about services. And there's been some questions about the ACAT assessment and also the home care packages to support aging, people who need care to stay in their homes. And just wondering if you could talk to the challenges around that.
Yeah, definitely. Thanks, Nina. And these challenges come from what I've observed in the community and working with older people and their families. I think what's important to understand is many older people and their families can feel quite isolated when they're trying to navigate the aged care system to find care. What does that look like in home or out of home care? And so that feeling of isolation is seen across many different people. And there are a number of challenges in the system in terms of we have quite long wait times for assessments. There are challenges in navigating the system, actually knowing where to go, who to talk to, and when you need to talk to them can be another challenge. And making sure that your family member is receiving the right level of care. So there's no quick and easy answer to all of these problems. These are systems issues that at a broader level we need to address. And there is also a level of uncertainty at the moment because we have a new Aged Care Act that is coming into effect in Australia. And again, that's creating uncertainty from a service provider perspective, but also for older people and their families. So I think I guess my discussion here is really around the importance that we need to optimize these services and systems to support older people to ensure that they're receiving the right care at the right time in the right way, particularly from a cultural perspective as well.
Fantastic. And just one last question heading to you, Heena. It's really a policy question about supporting especially our CALD communities, culturally and linguistic diverse communities with aging and with nutrition. I'm just wondering whether you can comment on that.
It's a good question. I guess what we're seeing is a lot of there's a drive around a lot of policies around women's health, and we can see that with Queensland around looking at shifting around the broader health and well-being. Whilst I guess nutrition and dementia is in that space, and as we see that in diabetes and prevention, I think we still have a long way to go to understand how that translates into community for culturally and linguistically diverse populations and women in particular. And I think we are at that risk of, as a CALD, we are all put into the one banner. So I think going into and looking at really specific community contexts is really important, and also bringing our and looking at across the lifespan course life. And I think we still haven't really looked at that at a way that it's mainly mainstream focus. We don't have a lot of our CALD community engagement in that space of policy to see translation of what's happening with the community.
Yeah. Thank you so much. So look, we're in our final wrap up now. Devi, thank you so much. You've given us such an insight into a range of cultures. But actually, as the audience has probably heard, there's so many threads that are common to all. And there's been some nice comments in the Q&A about the dominance of females attending this webinar, as well as the dominance of women in caring roles. And I think your work that really focuses both on those experiencing dementia, but those who are caring for them and who are caring for the carers, no matter which culture and home country they're in. So thank you. And Mikaela, you're, as a nutritionist and working in aged care and aged care research, I think what's for me very fascinating is that you've taken us beyond food, like, you know, a lot of dialogue on tea and toast, but talking about loneliness and how that links to health and well-being is so important, and those social connections. So really thank you for doing what we love to do in public health, which is that bigger context in which we're all living, and it's beyond direct nutrition, but those supportive factors. And then Heena, it's so fantastic you being able to describe your diabetes care program, which has been tested over 10 years, and we're going to be providing both the links to your videos, but also links to publications by all three of our speakers, as well as Sandra and myself, and position papers from the Australian Women's Health Alliance. But the Pacifica Diabetes Prevention and Awareness Campaign really gives us such a positive and promising program with so many features that are community-based, tailored for that community, but also features that can be adopted in other programs. So thank you for being able to provide solutions as well as context. So Sandra, handing back to you just to finalise and farewell.
Yes, thank you very much. And before I do leave, I'd like to just quickly, if the three ladies can just give one last key message, and then I'll summarise everything and then we'll close off. So Devi, just to you, one last key message to our audience.
Thanks, Sandra. I think we all agree women are primary care providers, but it is important to care for themselves too. So self-care is important so that we can provide all the care that our loved ones deserve. Yeah. Thank you.
Yes, thank you. Heena?
I guess it's important for us to remember that is it for me? Yeah. It's important that we need to remember as carers of our own health, we are the agents of the change within our family and our home and communities. So I guess as women, we need to create that legacy, and we need to weave that mat for future generations to sit on and lead that change.
Yes, thank you. Mikaela?
Thank you, Sandra. Building probably on what Devi and Heena have said, it's really about recognising the strength of women, the roles that they play in the community. When we talk about social isolation and loneliness, we obviously can talk about it in a negative light, but I think it's really important that we highlight the roles that women play in maintaining connection in their families, in their friends, in their communities. And if we can harness that amazing ability to relate to each other, that we can actually strengthen whole communities more broadly.
Yeah, thank you all. And I'd really like to thank you all. I think this has been a great conversation, and this is what we want to do in this webinar. Nina and I spoke about this, is that we just want to have the general conversation so that people at home can hear about this. And I think that you've raised quite a few number of key words: is self-care, social connection, share responsibility, intergenerational connection, informed questions, and framing your health work around yourself, around your family. It's really important that you go out and you ask, when you're doing all of this with your families and your carer, or even for your own self-care, make sure that it's that your health care, or your families, or whoever one shoe does not fit all, and we know that, and everybody has a different need, and it's really important to hear, you know, the tea on toast and how we do that. As Devi spoke about, is about prevent what we can do with that, and also with Heena about looking at, you know, how things can be more appropriate, culturally appropriate for different people, because we are such a diverse country now. We have to make sure that when we're doing policies that we have that inclusion of how we make those changes in our policies, and how we know that we've got a new Healthcare Act coming up very soon, where we can have a look at that. But one, I also want to take note for everybody is that we will be putting articles and what the ladies Devi and Heena and Mikaela wrote, we will be putting their articles and research papers on our web page. So if you'd like to go and have a look next week, sometimes they'll have their different articles up there, as well as we're going to be moving on from this. We'll be doing another podcast in another few weeks. And thank you all for coming on. We had over 850 people register for this event, and I'm really very honoured for all those. We know that a lot of people will not be online, but they registered so that they can get that recording. And it's really important that we share information, because we know information is knowledge, and we all want to know about that knowledge for our loved ones or for ourselves. But we live in an era now where it's about caring for each other, caring for each other with our hearts, but with our knowledge, and making sure that the individual person, whether they're lonely at home, that they can understand that they can reach out to somebody. Always reach out to somebody. If you know they're living at home by themselves. I know I have 2 neighbours around me, and they live by themselves, and I generally cook a meal because I live by myself. So I might as well cook for 3 people instead of myself. So that's a way of sharing and overcoming that loneliness of how we can eat healthy, and how we can, as Debbie was saying, you know, helping with prevention of dementia when it comes to our nutrition. And it's important that we share everything together. And that's why we're here on this platform today, doing this webinar, to share the information to you, to be realistic about how we talk to each other, and about, you know, just having a general conversation, a yarning circle. So thank you all. Thank you, Nina, for again supporting me with this, the Australian Women's Health Alliance. Really appreciate the input from all 3 of the ladies and their great answers and questions to us. And we hope that you can join our next conversation, which will be in another 5 weeks' time. And Nina and I will be putting another yarning circle around together about women's health. Thank you all very much. Thank you. Bye.